I'd like now
allora
to
adesso
call
invitiamo il
Dr.
dottor Leonello Milani
Milani to the rostrum.
a farci la sua
He's
lettura
going to talk to us
sulle
about chronic
infiammazioni croniche
inflammation
nel tumore
in
del
cancer
paziente.
patients.
Grazie.
Thank you very much. Thank you so much.
Allora, signori
Chairman,
cari
colleagues,
colleghi,
good
buon
afternoon.
pomeriggio a tutti.
Good afternoon, everyone.
Io insieme a voi
I'll
scambierò
be
qualche parola
talking about
sull'infiammazione
chronic
cronica,
inflammation
al di là del
above and
trattamento
beyond
antibiotico,
antibiotic treatment. And I'll be
concentrandomi
focusing
soprattutto
primarily
l'attenzione sul fenomeno
on
infiammatorio
inflammation
e
and
quello che attualmente, stamattina si è già
this morning
parlato di
we did
questo,
talk about this.
molecole altamente informative, comunicazionali, come le
Like
citocine
cytokines, for example.
in low dose, si è parlato anche
In
questa
overweight,
mattina
we
di
talked about
dosaggi non necessariamente
non-pharmacological doses,
ma
but bioactive
bioattivi
doses,
possono
and how
in
these can,
concreto
in fact,
aiutare
help
i
patients,
pazienti
oncological
e
and
non,
non-oncological
a
patients,
risolvere
to solve
o
or at least
modulare il
modulate
proprio stato
their inflammatory
infiammatorio.
state.
Questo è il mio
So
intention
that is
to
my
treat,
intention to treat,
e
and
quindi
together
insieme vedremo di
with you, I'd
elaborare
like to go
qualche
into
idea
some
interessante.
hopefully interesting ideas.
Prima di
Now, before
cominciare,
starting,
questa
this
mattina ho
morning
sentito
I heard
parlare
mention
anche di
of hormesis.
Per
And
coloro
for those
che
who
non abbiano
are
facilità
not
con
familiar
il
with
fenomeno ormetico,
hormetic
non certo
concepts,
voglio
I'm not going to
spiegare
explain
loro,
it,
voglio
the whole
soltanto
notion,
sottolineare
but I
alcuni
would like to
aspetti
emphasize a few
interessanti
interesting aspects
che ci
that
riportano
bring
non
us
necessariamente al
to
paradigma
the pharmacological
farmacologico ricorrente
paradigm
ed accademico
of
della cosiddetta curva
the
dose
dose-response
risposta.
curve.
Nel
Now,
paradigma
in the
farmacologico ricorrente
current
attuale, la curva
paradigm,
dose
the
risposta viene letta,
dose-response curve
quasi
is
come
seen
l'unica
as virtually the
possibilità
only
concreta,
real
reale,
opportunity
di
to
capire un
understand
fenomeno
a biological
biologico.
phenomenon.
A questi, il fenomeno biologico, sottostà quasi
Upstream of this, we
il
have
meccanismo
the ligand
ligando-recettore
receptor
come unico
mechanism as
meccanismo
the
di
only mechanism for
recezione di una
receiving a
serie
certain
di
number of
stimoli,
stimuli,
integrazione
integrating
dei medesimi.
these
Sappiamo
stimuli. I
oggi
mean, we
che
know
i
that
messaggi
messages, intracytoplasmatic messages,
non
are
sono
not
soltanto
only
fatti
made
di
out of
materia,
matter, and
e quindi
therefore,
in qualche
in some
maniera
way,
si
we
decostruisce il
deconstruct.
paradigma
We're
storico
deconstructing the
ufficiale
official paradigm,
che prevede la
envisaging
fisica
physics
come solo
as nothing
fisica
more than
meccanica.
mechanical physics.
Certamente, se la nostra
If
maniera
we
di leggere il mondo è soltanto la mela che cade sulla testa di
interpret the
Newton,
world as being
allora
nothing more than the apple
non
falling on Newton's
potremo
head,
mai
then we will never
capire la
understand
fisica
quantum physics,
quantistica, i
neutrinos,
le distanze
interplanetary
interplanetarie, le
distances,
relazioni,
and
e quindi
relationships. And
ad
so,
una visione
from
strettamente
a closely
antropocentrica
anthropocentric
della
view
biologia,
of
della medicina,
medicine and science,
da qualche
for the past
anno
few years,
molti
many
di
of us
noi
have been
hanno acquisito una
acquiring
visione
something more of a
biocentrica.
biocentric
Quindi non
outlook, hence
necessariamente
not
antropocentrica, ma biocentrica.
anthropocentric, but
Fenomeni
biolocentric.
che sono sotto gli occhi
Phenomena
di tutti,
that I think we can all see before our eyes, and that are being encoded today
quasi
and almost interpreted
in una maniera ancora
in a proto-historical
nel senso di se
sense.
storia
If
è la
history
fisica
equates to
meccanica,
mechanical
protostorica è la
mechanics, then
visione
proto-history
di
is
questa
the view
alla
of
visione
this
nuova
in the new
di una
light
lettura
of a
diversa.
different
E
attitude, a
insieme
different
vedremo
approach.
di
And together,
praticare
this is
questa
what we'll be venturing
lettura.
into.
Beh, va da
I
sé
think
che io alcune cose sono state
there are a number of things here that have already been said. In reality,
il paziente
patients who have cancer are immunodepressed. Yes, perhaps that's better. They're immunodepressed because, generally speaking, they're over 45 years of age, and since over the years, doctors have been able to lengthen people's lifespan to 75 or 80 years, we know that Homo sapiens samiens, linear as a human being, is a creature who biologically, in situations of occasional environmental impact should not live more than 45 years. But the reproductive age is established by Mother Nature with an estrogen and progesterone peak, with a testosterone peak, and with peaks in physical strength, hemoglobin, etc., all things that have been proven. All these things happen between around the age of 20. But it's curious that the proteoglycans and isosamine glycans peak and the extracellular matrix peaks at that same time. And it also is the period of the highest immune response, type 1 and type 2. So a man who uses a cell phone, speaks 10 languages, flies across the Atlantic at the speed of light, in 2010 has the body of Homo sapiens of maybe 15, 20 million years ago. Nothing has changed. Someone this morning said, well, maybe there have been changes, genetic changes, taking place every day and every minute. But until for a gene to establish itself in the human genome and to be selected positively and belong to the genome as a heritage of the species DNA, that takes between 20 and 30,000 years. So the cell phone's not what makes us different, it's our body that makes us feel ancient. Hence, after the age of 45, we see immunodepression developing. Pharmacoradio and chemotherapy lead to lowering immune defenses, depression, mental depression. Patients with cancer know this or imagine it. And these are patients who may have a shorter lifespan, hence the fear of death. And if every man is that same person, then of course things are not looking too bright. So stress, PNEI depression, antibiotic therapy, as the previous speaker mentioned. In any case, you have a major alteration in the endogenous bacterial flora and alterations in JLT. Here I'm talking about 80% of immunity. I'm talking about 80% of the formation of lymphoepithelial bodies. Hence, thank goodness we have antibiotics when we need them. At that time, the patient, though, is immunodepressed. This is why E. coli, which is a normal saprophyte of the intestine, tends to thrive, because among the various resistances between lowering the immune system, that's what it creates. And we often speak about disease as if it came from somewhere else. And it is always an almost causative attitude of disease and not a casual aspect of the disease. It's the person who gets the disease and who is the disease. It's not E. coli or staph. They will cause the symptoms, but depending on the immune status of or the HLA, the haplotypes, or their inheritance systems, hereditary system, some certain responses will occur and others will not. In antibiotic eras, two members of the family would develop TB, and two would win Olympic medals for marathons. Hospitalization, that goes without saying, increased risk of opportunistic bacterial infections. For some time now,